Veterinary pharmacology. What term is used to describe a more gradual decrease in responsiveness to a drug, taking days or weeks to develop? Tolerance. Tolerance is used to describe a more gradual decrease in responsiveness to a drug, taking days or weeks to develop. Tolerance is used to describe a more gradual decrease in responsiveness to a drug, taking days or weeks to develop. What term is used to describe tachyphylaxis? Tachyphylaxis. Tachyphylaxis describes a decrease in responsiveness to a drug which develops in a few minutes. Tachyphylaxis. Tachyphylaxis describes a decrease in responsiveness to a drug which develops in few minutes. Tachyphylaxis. Tachyphylaxis describes a decrease in responsiveness to a drug which develops in few minutes. And increase metabolic degradation. Toxic and drug resistance can be consequence of increased metabolic degradation. Tolerance and drug resistance can be by increased metabolic degradation. Tolerance develops because of none of above. The situation when failure to continue administration of a drug results in serious psychological and somatic disturbances is called abstinence syndrome. Abstinence syndrome. Abstinence syndrome is when failure to continue administering a drug that results in serious psychological and somatic disturbances as abstinence syndrome. The situation when failure to continue administering the drug results in abstinence syndrome. What phenomenon can occur in case of using a combination of drugs? Synergism can occur in case of using combination of drugs. If two drugs with the same effect taken together produce an effect that is equal in magnitude to the sum of the effects of the drug given individually is called additive effect. Additive effect will be the effect if two drugs with same effect taken together produce an effect that is equal in magnitude to the sum of the effect of the drugs given individually is the additive effect. Which of the following drugs is a 5-log inhibitor or 5-lipoxygenase inhibitor? All Xylotone, or name available as Ziflo or Xylotone. Xylotone or Ziflo is a 5-log inhibitor, 5-lipoxygenase inhibitor. Xylotone is a 5-lipoxygenase inhibitor. Which of the following drug is a leukotriene D4 receptor blocker? LTD4 blocker. Which of them is the leukotriene D4 blocker? Zafirlukast. Zafirlukast is a leukotriene D4 receptor blocker. Zafirlukast is a leukotriene D4 receptor blocker. Which of the histamine H1 antagonist is noted for serotonin blocking effect? Cyproheptadine. Cyproheptadine is which of histamine H1 antagonist? The histamine H1 antagonist as cyproheptadine is noted for the serotonin blocking effect. Cyproheptadine. Cyproheptadine is a histamine H1 antagonist that is noted for serotonin blocking effect. Which of the histamine H1 antagonist is noted for Ulcerogenic effect. Diazolin. Diazolin is an histamine H1 antagonist that causes ulcers. Ulcerogenic effect. Diazolin has ulcerogenic effect and it is H1 antagonist. Side effect of first generation histamine H1 antagonists is sedation. H1 antagonists cause sedation. First generation H1 antagonists cause sedation. The immunosuppressive agents are all of above. The immunosuppressive agents are corticosteroids, cyclosporine, and tacrolimus. Tacrolimus or FK506. Tacrolimus, cyclosporine, and corticosteroids are immunosuppressive agents. Class of cyclosporine A is immunosuppressive agents. Cyclosporine A is immunosuppressive agent. Side effects of cyclosporine A is gastrointestinal disturbance. Cyclosporine A causes gastrointestinal disturbance. Cytotoxic agents are following. Cyclosporine is a cytotoxic agent. Cyclosporine is a cytotoxic agent. Cytotoxic agents are all of the following except cyclosporine is not a cytotoxic agent. Cytotoxic agents are azathioprine, leflunomide, and cyclophosphamide. Azathioprine, leflunomide, azathioprine, and cyclophosphamide are the cytotoxic agents. Cytotoxic agents are azathioprine, leflunomide, and cyclophosphamide, but the one that is not cytotoxic is cyclosporine. The side effects of interferon gamma is fatigue. Interferon gamma, the antiviral, causes fatigue. Exophthalmos is a feature of toxic goiter. Exophthalmos is a feature of toxic goiter. Acromegaly is caused by hyperpituitarism. Hyperpituitarism causes acromegaly, or acromegaly is caused by hyperpituitarism. Neuritis is observed in Meigs disease. Meigs disease has neuritis. Necrosis of brain is known as encephalomalacia. Removal of dead neurons through microglial cells is known as neurophagia. Neurophagia is the removal of dead cells through microglial cells. Increase in number of white blood cells in cerebrospinal fluid is termed as pleocytosis. Increase in number of white blood cells in cerebrospinal fluid is termed as pleocytosis. Pleocytosis is the term when there is increase in number of white blood cells in cerebrospinal fluid. Spongiform encephalopathy is called by prions. Which of the following belonging to second generation quinolones? Difloxacin. Difloxacin is a second generation quinolone. Difloxacin is a second generation quinolone. What is the drug rate of enrofloxacin in cattle? 2.5 mg per kg is the dose rate of enrofloxacin. It is available as an N-Cure brand name in Pakistan. N-Cure or enrofloxacin. The dose rate is 2.5 mg per kg in cattle. What is the dose rate of florfenicol in cattle? 20 mg per kg is the dose rate of florfenicol in cattle. The dose rate of florfenicol is 20 mg per kg and 2.5 mg per kg is of enrofloxacin. Enrofloxacin 2.5 mg per kg and 20 mg per kg is florfenicol. Which of the following drug is regarded as the first antibiotic of tetracycline group? Chlorotetracycline is regarded as the first antibiotic of tetracycline group. First antibiotic of tetracycline is the chlorotetracycline. Which of the following drug belong to short-acting tetracycline group? The short duration of tetracycline group is oxytetracycline. Oxytetracycline is a short-acting tetracycline group or tetracycline. Oxytetracycline is a short-acting tetracycline. Which of the following was the first member of aminoglycoside antibiotics? Streptomycin was the first member of aminoglycosides. Streptomycin was the first aminoglycoside. First aminoglycoside was streptomycin. Ceftiofur is a third generation cephalosporin.